How are they trying to scare you into getting the vaccine? I would have thought 126,000 people dying was enough to make you
Well, you
think
see,
twice
that's just
about
the
it.
start of it, because the numbers are not accurate. For example, we've seen, for example, them saying, A&E is absolutely full of people, full of casualties. I live and work very close to a hospital, right? And I remember watching the news and seeing that, the hospitals are full. I saw on the news there was tons of ambulances outside. They said they were so understaffed, well, not understaffed, but there were so many people in there that they couldn't even have enough staff to look after them all. My daughter happened to break her finger that very same day. I went to that hospital. We were there for a total of 15 minutes before getting seen, because the hospitals are absolutely empty. Okay?
Oh,
So we are being
please.
lied to.
I mean, just listen to yourself. You're saying the hospitals are absolutely empty. Where have you been for the last year? Are you saying that all of the people in the NHS are lying about the number of people in their hospitals?
The numbers are definitely being exaggerated and inflated 100%. I have many relatives.
I'll tell you what. There'll be nurses and there'll be nurses and doctors listening to you say that will say, "Why don't you just take her off air?" Because that is just a lie, Sarah.
I live with a nurse who works in a cardiac wing. I live with a nurse. My sister is a nurse who works in a cardiac wing in a very busy London hospital. So this is not coming from just my one experience of going to A&E with my daughter's broken finger. This is coming from nurses that I know personally. I myself work in healthcare, okay? And I'm not saying that people haven't been affected. I'm not saying that the numbers are complete lie. What I'm saying is that they've been exaggerated. And when we do raise our concerns about things, for example, like numbers being exaggerated, we have people like you who will respond in that same way and say, oh, please. Like, if you're going to ask, at least be respectful of my view. That is my view. In my opinion, and in my view, and from my experience, the numbers have been overinflated. That is not to say that people haven't been affected by the COVID-19 virus.
What do you say to all of the black people who have been involved in the development of the vaccine, who are nurses and doctors, who work in NHS hospitals, who are administering the vaccine? You said earlier that...
Like I said, my sister's also administering the vaccine. She's a nurse. She administers the vaccine on the weekend.
Has she taken it?
No, she hasn't. No, she hasn't.
So why is she administering it then?
And this is the other thing, getting black people, which is going to answer your question as well, getting people like Lenny Henry or whoever to come and advocate and say, oh, get the vaccine, that doesn't mean anything, because people do whatever pays the bills. So if you're going to pay Lenny Henry £100,000 to make an ad to say, take the vaccine, I'm not going to...
Well, I don't think he's taken any money for it. I don't think he's taken any money for making it.
Well, anyone who's... that's the assumption. If I see Lenny Henry on TV advocating for go and get the jab, I'm suspicious, okay? I'm already feeling a bit, suspicious of why so much pressure on the black community to get it. Get the vaccine. There are so many more issues that affect just the black community.
The reason is because, we're all under pressure to get it for all the reasons that we know about. And the fact is that not enough black people are getting it. So, yes, there will be public health campaigns. There will be pleas to GPs to try and increase it. There's no sinister reason behind it. What would be the sinister reason behind it?
My response to that would be then, in history, right, or just in society today, there are many, many, many things that affect the black community more than they do affect any other community, for example, right? There are many things. The government do never place so much importance on fixing this issue when it comes to black communities without us fighting for it. So it just is quite suspicious that firstly they wanted to...
So what are you suspicious about? What do you think they're trying to do? Sort of administer the vaccine and kill all black people or something? Is that what you're saying?
The thing is, do you know what? In 5, 6, 7, 8, 9, 10 years, if people are still, okay, and there's been no long-term effects of the vaccine, because you said, oh, well, we know it's safe because of this, because of that. But at the end of the day, we don't know that it's safe. Okay?
Well,
We know
it'll be
that
too
it's
late
safe
by then.
short
It'll be
term.
too late by then, because there'll be hundreds, if not thousands, of black people who will have died because they've got coronavirus because they didn't take the vaccine. That's the simple truth of it. And you're somebody who is sticking their head in the sand, I'm afraid.